Hello, everyone. Today on Bebo, we're going to be spending some quality time with the My Density Matters organization, and we're going to be talking about breast density. It's an extremely important subject that most of you don't know enough about. We're going to spend the whole day talking about this important issue and how you can make sure that you have the information you need, especially you ladies out there, for knowing your true breast health. Welcome to Bebo Today.
Time to shine. My time to shine. I'm ready. Yes, I'm ready. It is time to redefine. I'm ready. Yes, I'm ready. I
Today on Bebo we're talking about a very important topic, and that's breast density. Now, I'm sure there are a lot of you out there that may not know enough about this very important topic. Well, we're going to answer all your questions here today because it truly is something that every woman especially should know about. And I'm here with two ladies that I think are experts on this subject. I'm here with the person that I consider an influencer in this space, the founder of My Density Matters organization, Leslie Yerger, and I'm also here with Susan LaPlay Miller, who is the vice president of programs and partnerships of My Density Matters. Ladies, thank you so much for being here.
Thank you.
Thank you for having us.
Absolutely, absolutely. And again, Leslie, I meant that sincerely, that I do consider you an influencer in this space and bringing this information to the forefront.
Thanks.
Thank you, thank you. Now, we're going to define what breast density is. We're absolutely going to do that today. But I want to start with your story because that's how we got here today. Would you mind sharing a little bit about the origin of this incredible organization?
Absolutely. Over 6 years ago now, I was diagnosed with stage 4 breast cancer 2 months after an all-clear mammogram. And that was because I have dense breasts and the cancer, which is not visible on that mammogram. And everybody should know I'm fine. I'm still on the first line of treatment that I was put on right after diagnosis, and it continues to work. And I'm very grateful for that. And now I feel like it's my calling, my mission to share this information with, as you said, every woman out there, so that their story would not become my story, because we can do better and we must do better.
Absolutely,
Yeah.
absolutely. Well, I'm so glad to hear that you're well and you look great.
Thanks.
And I'm glad that you've taken this as your calling now to educate the masses, because a lot of women, myself included, did not fully understand what this is about. So I thank you for that. And Susan, you're involved, very much involved in this organization. What is it about this mission, about this organization, that made you say and step up to say, I want to be a part of this?
Well, mostly it's this woman right here, because she and I have been friends for about 20 years. I've dragged her into volunteer things, and during the pandemic, I had written an article about compassionate care and helping the elderly and the at-risk population to become less isolated. Leslie saw my article and she reached out and said, hey, what are you doing? Like, what's going on? And my initiative was called Teach One. We started talking about how important it was to help those in need and empower people. And she started telling me her story, and I'm like, yeah, I have dense breasts, but I don't have a family history. And she said, Susan, that's a myth. Like, yes, it's important if you have a family history, but if you have dense breasts, you need additional screening.
Right.
And so I didn't, she said, I don't want my story to become your story. And I'm like, I think that we need to do something together, and let's work on this and see what we can do to empower people.
Fantastic. Well, the two of you have done an amazing work thus far, and I know there's a lot more work to do.
Yes.
Absolutely, absolutely. Why do you think that this topic is so important? Now, to me, it's obvious, but for someone who may be watching us today and they're still trying to connect the dots, why do you think this is so important? Leslie.
Well, there are 2 reasons why women need to know about breast density and be empowered to act upon that information. So the first reason is that breast density can make it harder to see cancer on a mammogram.
Right.
And so a fair amount, depends on who you talk to, what the number is, but can it be up to 50% of breast cancers can be missed on a mammogram in a woman with dense breasts. So that's the first reason. The second reason is that breast density is an independent risk factor for developing breast cancer in the first place. So double whammy.
Yeah.
So those two things together are why every woman should know her breast density and have the appropriate conversation with her doctor about additional screening.
Absolutely. Well,
Yeah.
we're going to get into some of the tools
Yes, we
that your organization has brought to the forefront and helping women identify and understand better where they are on the charts and so forth. And Susan, I know you're going to be here to get us started with the first tool, right?
Absolutely.
Okay, so we'll be right back with more. We're going to get into some helpful tools that you can use right at home to help you understand better about your breast density. We'll be right back.
I'm Dr. Monique Gary, breast surgical oncologist in Pennsylvania. If you know that you have dense breasts or that additional screening has been recommended by a radiologist, it's time for you to collaborate with your referring physician to get what you need. You can always schedule an appointment by phone or virtual visit to discuss your density and what comes next. You can also message your doctor through the online portal. Whatever you do, don't delay. It's important you take charge of your breast cancer screening and have a full and collaborative discussion with your doctor about essential next steps.
We're back and we are continuing the conversation today around breast density health. And we're going to talk about the first one of some tools, right? Several tools that My Density Matters organization has that can help you learn more and know more about your breast density. Susan, again, welcome.
Thank you.
Thank you.
Great to be
And
here.
we're going to talk about the first tool, right? And it's called Check Your Chart, if I believe. Is that
Yes.
correct? Okay, great. Can you tell us about this tool?
Yes, every tool we have with My Density Matters is an education to action. We want action.
Yes.
And Check Your Chart was created because your mammogram report is in your patient portal. And we tell people to find out your breast density, but the way they find out is through their patient portal by reading their mammogram report.
Okay, and for those who may not be familiar, because I know some hospital systems actually have what's called a patient portal. Not all do, especially private doctors. So what is a patient portal for those who may not have access to that currently?
Yes, a patient portal is an online record, and it has your test results, so it could have your blood results, your blood pressure even, notes from your doctor. You can schedule appointments on some of them. You can pay your bills on some of them, but it's an online portal that you have access to your health information from.
Fantastic. So if a particular medical system where your doctor may be associated with or affiliated with, if they have a patient portal, you're saying that we can use that as one of the tools to help us understand breast density.
Absolutely.
Great.
That is your record. So
Fantastic. Now, if someone has access to a patient portal, again, not all health providers do, but if yours happens to have that, where would they find this information in the portal?
So you would look for your test results.
Okay.
And you would look for your mammogram report. So the letter that you receive at home is not your mammogram report. That is a lay letter. But in your actual record is the report from the radiologist. So if you look for your test results, you can read your mammogram report. And there's some terminology on there that may not be familiar. And so Check Your Chart was created to help you understand what that terminology means. How do you get into your portal? How do you read your mammogram report? What does it mean when you read certain words? And then help facilitate that conversation with your doctor so that you have a better collaborative relationship.
Fantastic. So again, if someone has access to their portal, their medical portal from their doctor, they would go into their test results. Now, once they get there, how does the Check Your tool come into play? Is it something that sits on the mydensitymatters.org website, or is it something that can be used in conjunction with looking at their actual patient portal?
Yeah, it's used in conjunction in the way that the Check Your Chart helps you get into your portal in the first place by
Great.
teaching you how to look for things.
Okay.
And then in terms of the understanding the terminology, and if you're recommended to have additional screening, we help you understand what the additional modalities are
Great.
and what that means to you for, for the different
Fantastic.
densities, and your doctor may recommend one thing that you might not understand. And we have all that information on our website, and then through the software platforms that we're integrating technology to make this people process technology.
Exactly.
Make
No,
it
that's
better.
great. Because again, a lot of individuals, a lot of women specifically, don't understand breast density in general. And if we're honest, for those of us that go to the doctor on a regular basis, we just run to our test results. We want to make sure everything's okay, and then that's it. But we don't really dive into our test results. So what you're advocating is that with this tool to help us, we can dive a little bit deeper into those test results and better understand the full picture.
Correct. Because if you read your mammogram report and it says you're heterogeneously or extremely dense, and you've not been prescribed additional screening, you need to find that additional screening. Now, you could put a note into the portal and say, I would like to discuss my mammogram report with you to your doctor. You could ask a question in there. Generally, they want to speak with you about the answers to those questions at an appointment.
Right.
But at least if you put it into your record, they know at your next appointment they want to discuss it with you, or they may call you and say, you're right, we need to talk about this. But you're responsible for your own health. And your doctors don't have a lot of time at appointments. So if you can prepare and have a better conversation by letting them know, this is an area I want to discuss with you, and you walk into your next appointment, they are prepared to have that conversation, or they can reach out to you and have that conversation as well.
Absolutely. And you become a more informed patient.
Absolutely.
And you become a person that can walk into a subsequent conversation with more intelligent questions around your health.
And it prepares the doctor as well. Like they are busy. So if they know that you specifically want to speak about this, they're prepared. It actually helps them by knowing that this is something that you want to talk about.
Fantastic. Well, again, I congratulate your organization for providing this guidance and this tool for folks, especially women, to understand their charts and to have that intelligent conversation with their doctor to know more about their breast density. So we commend you on that. And this is just one of a few tools, if I understand correctly.
One of many
One of
action
many.
tools.
Fantastic.
And everything, we want you to collaborate with your healthcare team. They're part of your team. They're part of your health. So let's make it a better conversation, a better relationship.
Fantastic. And to find this Check Your Chart tool, where would they go?
Well, you can have access to it from the My Density Matters website, but they can also text to the number 211411, check your chart, and it will walk you through. We also can get to it via QR code. But if you go on to the My Density Matters website and look for programs, check your chart, that's another way.
Fantastic. So I encourage all of you that are watching us today to go over to mydensitymatters.org. Of course, that website's going to be running along the bottom here. Make sure you go over there and get plugged into the Check Your Chart tool. And again, some of the other tools that we're going to be talking about right here today. We'll be back with more on this very important subject today here on Bibo Today. We'll be right back.
It's as simple as checking your chart for you to understand your breast density. Open your MyChart app and look into it and see what your report says. And if it is C or D, then you can advocate for yourself and reach out to your primary care physician and ask to put in that order for the supplemental exam.
Welcome back, and we are continuing the conversation around breast density health. Now, we're going to talk about yet another tool that you can use right at home to help you better identify and know more about your breast density. And joining me right now are two new members, or other members, I should say, of My Density Matters organization. We have Laura and Labanita. Thank you both for being here.
Thank you.
Yes, and Laura, you've been here with us before.
I have.
So welcome back.
Thank you.
And we're going to start talking about, talking about Ms. Veronica's story, and then we'll go right into the next tool.
Absolutely. So I am Laura Matuszewski. I'm the Director of Development and Public Relations for My Density Matters, and part of what we do is community education. I was at Harper College in October giving a presentation about breast density, how to find it, why it mattered, and after my presentation, they showed a clip of a Harper professor who had her cancer missed, and she told her story by video because she couldn't join us that day. And it was just so compelling as to why we do what we do, because just like Leslie, her cancer was missed because she had extremely dense breasts. She really had to advocate for herself, which is something that we are so passionate about at My Density Matters, because nobody knows your body like you. And Veronica knew something wasn't right, even though they told her her mammogram and her ultrasound were fine. She even had additional screening that still said everything was fine. Wow. She had 3 cysts, and they thought they were just cysts, and they just told her that they were gonna give her an ultrasound every 6 months and keep an eye on it. The nurse followed up with her and had her come back in. So the doctor ordered the additional screening that still didn't find anything, and she said, "You need to feel this." And so at that time, he felt her tumor, which had come to the surface because she had lost a lot of weight. So it was hidden for a while in some fatty tissue. After she lost weight, that tumor came to the surface, and once he felt it, he ordered a biopsy. And she had stage 3 breast cancer. So they told her if she would have waited even one more month, she would have been at stage 4. So Veronica is the perfect example of how you need to advocate for yourself, and don't let anybody tell you you're being difficult. It's your body, it's your life, and you need to get what you need.
Absolutely.
So that's why Veronica's such a compelling story. And with community education, we find these women all the time who have similar stories to Leslie. So we just want people to understand it's not a fluke. It happens more often than people realize, which is why our organization was developed. So that you can be educated, you can be your own advocate, you know what screening to ask for, and you don't give up until you get it. So that's why Veronica's story is so powerful, and we wanted to share it.
I love what you said about being an advocate for ourselves. And in the past, we just took whatever the doctor said, and that was it. And now, it's a different world.
It is.
And we do need to be more educated about our bodies. And that's a great segue to you, LaBonita, because now we have this tool, the screening guide tool. And LaBonita, please tell us more about this incredible tool. And again, Veronica is a great poster child, if you will, for why this tool is so important.
Yeah, and so some of the things that I've been working on is very much taking what Veronica's, her education and knowledge that she had, she was able to push for the screening that she needed. But not everyone's at that level. There's different changing research, new guidelines, recommendations that change year to year, and it can be really hard to keep up with all the changes. So what we wanted to do at My Density Matters is really empower and educate women so that they're knowledgeable about what they need to do for their own health. And one way that we've done this is creating this breast cancer screening guide. And what this does is it basically aligns your individual answers to what the ACR currently recommends. The ACR is the American College of Radiology, and they just recently came out with a new set of recommendations. Women as young as 25, because they want women to get their breast cancer risk assessment done early, because they're finding that more and more women are having cancer at younger ages, and they're missing it because they're getting screening when they're older. So what they want women to do is, if you're in that high-risk category, they want to know early so you can get screened early. So that's kind of part of the guidelines that are constantly changing, and this guide is really helpful in that you can take it, takes 2 to 3 minutes, time efficient, very easy to use, and at the end you get a screening plan. And with that screening plan, we want you to go and talk to your doctors. That's the biggest thing. We want you to be educated, we want you to know what to ask for, and bring this so you can have a conversation with your physician, with your gynecologist, nurse practitioner, whoever it is that you see on a daily, yearly basis, to really start this conversation. And part of the thing that we're doing, the breast cancer screening guide, is try and meet women where they're at. So part of our community education, going to health fairs, fitness events, school events, so that we can meet women where they're at, share this screening guide, share this information, so that we can empower more women and have more women feeling confident going into the new year as they focus on their health more.
Love it. And tools like the Check Your Chart, the screening guide, these are tools that can be found, again, through mydensitymatters.org website, right? But to play devil's advocate for just a quick second, are these tools, or the outcomes of these tools, are these things that a doctor or a nurse practitioner would take seriously? Someone may be watching and saying, well, this sounds great, but is it going to be respected enough when I sit down and have that conversation with my gynecologist or my doctor or whatever the case may be?
That's a great question, and everything that we do is with the help of our medical advisors. So, we have radiologists, breast surgeons, oncologists from all over the country who help us make sure that the information that we're providing is accurate. And so everything that we're doing is by the book, kind of. So the American College of Radiology, their recommendations from 2023, that's the most updated. That's what we're doing, our breast cancer screening guide. Our Check Your Chart, all those videos, all the information we're providing is all been vetted by numerous physicians and numerous practitioners so that we are providing accurate information.
And, just to circle back to Labanita's comment with the community education, if you go to mydensitymatters.org and you fill out something that you want us to get in touch with you, we're happy to come to companies. We're starting to do women at Google, women at different companies to come educate women everywhere. We want to meet women where they are, and if your company or your networking organization is interested in bringing our education to you, please reach out, and we'll try and definitely do it either through Zoom or in person.
Fantastic. Well, again, thank you both. Again, we thank Veronica, we thank Leslie, because by them being trailblazers, if you will, and being very adamant about not only getting a diagnosis, but getting educated because of women like Leslie and Veronica and others in your organization, My Density Matters exists. So we thank you both, and we thank the organization at large. Great.
Thank you.
Everyone, we're going to be back with more BIBO Today.
My name's Marie, I'm 55 years old, and I'm a breast cancer survivor because I had supplemental screening for my very dense breasts. Found early at stage 0, non-invasive, treated and removed, and as my radiologist told me of the day of my biopsy, the breast cancer I have when found small is the best kind of breast cancer to find. So get your supplemental screening because it makes a difference in your life.
Welcome back, everybody. And again, we are continuing this very, very important conversation today around breast density. And joining us, not only an expert in the field, but someone who knows the founder of My Density Matters organization very, very well, Dr. Barry Rosen. Dr. Rosen, thank you for being here.
Thank you very much for inviting me.
Absolutely, absolutely. Can you tell us a little bit about who you are, and your involvement with My Density Matters?
Yes, thank you. I'm a breast surgical oncologist, and I've been in practice now for over 25 years here in the community. And in the course of my career, I've tried to move more and more from the treatment side towards the prevention side. And we recently have opened a cancer prevention center here at Advocate Good Shepherd Hospital that I'm proud to say that I'm the medical director of as well.
We have some folks that have questions for you as our resident expert today. And we definitely want to get these questions in because I'm sure some of these questions are questions that our audience may have as well. Okay?
Wonderful. Thank you.
Okay, so we have the first person up to the microphone. Welcome.
Yes, thank you, Tracy. I'm Suzanne from Cary. And Dr. Rosen, do I have to worry about breast density if we have absolutely no family history of breast cancer?
No, if you don't have a family history of breast cancer, you are still at risk for breast cancer, and density can run in the family, but most importantly is that every woman should know their risk of breast cancer and then do the appropriate screening for them based upon their age and based upon their risk.
Another person, thank you. Thank you for joining us.
Hi, I'm Terry from Barrington. And I'm wondering, can breast density change over time?
Yes, it can. And density is a moving target. You know, we understand density, but we don't know everything that we probably need to know. And I think what's very clear, first of all, is to understand how do we identify density. It's not something that you can feel. I think every woman who's been seen by a physician and has had a breast exam has been told, oh, your breasts are very dense. And in point of fact, when we talk about breast density and breast cancer risk, it's not what you feel. It's what you see on imaging, typically mammography or MRI. We can also evaluate density by MRI. So what we're doing with a mammogram is that the radiologist is looking at the glandular tissue, the tissue where the cancers form, and is looking at the fat. Most of the breast is fat. And they're simply looking at the ratio of glandular tissue to fatty tissue. And we somewhat arbitrarily put people in 4 different categories, A, B, C, D. And just like school, you rather get an A than a D.
Absolutely, absolutely.
This varies by country. In the United States, slightly less than 50% of all women have what we would classify as dense breast tissue, which would be C or D. And about, of those half or so women who have dense breast tissue, a majority of those women have category C, heterogeneously dense breast tissue. And about 10% have category D, extremely dense breast tissue. This can vary from mammogram to mammogram for a number of reasons. First and foremost, it's qualitative, not quantitative most of the time. So the radiologist who's looking at your imaging may call it a C, and one of his or her colleagues might call it a D. We actually do have AI software now that can help the radiologist with density, and that takes away some of that arbitrariness.
That's great. That's great. Great question. Thank you so much. I think we have one more question.
Hello.
Hello.
My name's Ariana, and I'm from Barrington. I have a two-parter, actually. If my breast density is a C or a D, what screening method is best for me? And also, would my insurance pay for additional screening?
Okay, why is density bad? First and foremost, it masks cancers. So what we like to say is it's like, and very fitting for the weather today, it's like looking for a polar bear in a snowstorm. If you have extremely dense breast tissue, if a woman has a cancer in their breast that we're not aware of, and they go in to get a mammogram, and they have category D, extremely dense breast tissue, there's a 25 to 50% chance we won't see that cancer. So dense breast tissue will mask a cancer. You can overcome that masking effect with supplementary imaging, and I'll get back to that in a second. The second fact is that density is correlated with an increased risk for breast cancer. So not only does it decrease our ability to detect cancer, but it also is an independent risk factor for breast cancer. Wow. And so it's very important for both of those reasons to know your density. Now, if you have dense breast tissue, a mammogram will never be enough. Never. There are a number of tests that can be done that have some pros and cons to them for supplemental imaging. A screening ultrasound, molecular breast imaging, contrast-enhanced mammography, MRI. Those are the 4 most common tests that we utilize right now in the world to overcome the density to try to find that cancer that may or may not be there. Now, all of these tests have pros and cons. They have variable costs, there's variable insurance coverage, and the short answer to your question is you need that supplemental imaging if you're C or D, and you need to check with your insurance company to see if they will cover that.
And that's why a lot of women don't get that additional imaging and testing because of the cost.
Exactly.
Yeah,
and it can be quite cost prohibitive.
Yes.
A breast MRI is in the thousands of dollars.
Absolutely.
But if you have category D, extremely dense breast tissue, and or if you have a high lifetime risk of breast cancer, we can measure that using different risk calculators. I think that the best test for that woman to get in addition to a mammogram is an MRI. So the MRI is the most sensitive test for breast cancer. When a woman goes to get a screening mammogram, we're going to find a cancer about 6 times for every 1,000 mammograms that we get. If you added MRI, we'll find about another 15 cancers.
That's significant.
Yes.
That's,
Now, a screening ultrasound is a wonderful test. It is, there's no radiation, it's not painful, it's easy to perform. You'll find about another 4 cancers for every 1,000 ultrasounds that we get. So you can see that there's a difference between sensitivity, but there's also a difference in cost. So if a woman is category C and or average risk and has, then what I recommend is a screening ultrasound. If they're category D and or elevated risk, I recommend an MRI.
Fantastic. Great question. Great question. I truly hope you enjoyed today's episode here on Bebo today, all about breast density. It's a very important subject. It's probably not talked about enough. And here today, we just scratched the surface on this topic that could save your life or the life of a loved one or friend. Okay, so make sure you go over to mydensitymatters.org. The website is scrolling across the bottom right about now, mydensitymatters.org. Get plugged in to this organization. At a minimum, make sure you get plugged into some of the tools that you learned about right here today. Until next time, we're going to close out with yet another great musical guest and in this crazy world that we're all trying to live through. Make sure you stay safe, you stay healthy, most of all, you stay blessed, and we'll see you next time.
Heart is racing, hands are sweating, knees are shaking, my stomach's full of butterflies. Ears are ringing, breathing is erratic, my mind's distracted, it feels like I've been hypnotized. The correlation with the stimulation, it's a simple equation, it's undeniable. You're the one